Greetings, greetings. Eric Bakker, naturopath from New Zealand, author of Candida Crusher, and also creator of this YouTube channel. Thanks so much for checking out the channel. I really appreciate all your feedback. The comments have been very, very good. I've had many people over time asking me to do, some videos on detoxification and cleansing, liver cleansing, kidney cleansing, things like that. So I just did yesterday a video which I uploaded on liver, how to do a liver cleanse. So I hope you've seen that one, because that is the precursor or the video you need to watch right now. So click on the link right now. If you haven't seen it, watch that first and then catch me back here. But if you've seen it, awesome. We're going to talk about a gallbladder flush. All right, that's going to be the topic. So I don't want you doing a gallbladder flush until you've done a liver cleanse. Right? It makes sense? It makes sense to me. The liver produces stuff called bile, this green stuff. Looks a bit like dishwashing liquid. All right? That's what we're going to talk about, dishwashing liquid. I like giving people sort of like examples in real life instead of these highfalutin biochemical technical sort of talk. So most people who watch my videos are just like me. They're plain common sense people, and that's why I like to create common sense videos. Not some crazy wacky stuff where I wear white coats and talk about all these equations and junk that people aren't interested in. So what's dishwashing liquid got to do with a gallbladder? What a crazy thing that Bakker's talking about now. Well, let me tell you. We've got this stuff in New Zealand called palm olive. I don't know if you've got that in the States or Canada or wherever you're watching this from. It's this green dishwashing liquid. And I worked out a long time ago when I was a kid that if you're washing dishes and you've got hot water and you've just had some greasy pork chops or some nice piece of fatty pizza, or you've eaten something with a bit of fat on it, let's say, okay? You put that in your sink, you fill it up with water, and then you try and wash the fat off with water. So what happens? Is it going to come off? Probably just going to roll off, isn't it? The fat's not really going to break down with the water, is it? So now what happens when you put one drop of dishwashing liquid on a fatty plate? You see, poof, you see all the fat start to dissolve. Okay, it breaks down. Okay, it emulsifies. It creates a biochemical reaction. Okay, or I shouldn't say bio, okay, it's a chemical reaction where the fat breaks down under the presence of this particular substance called dishwashing liquid. Now, bile, there's the same stuff in your gut with fat. It helps to break fat down. It helps to emulsify, to clean, to move out. Bile's quite a toxic substance, so the liver likes to get rid of junk, and it will do so through the bile. So remember, we spoke in the previous video on liver detox about the two main pathways. Phase 1, Phase 2. Phase 1's a bunch of enzymes. Phase 2 works by way of 4 or 5 chemical reactions we call glucuronidation, right? Toxins come into the liver. It's a huge big chemical factory that gets rid of poisons out of the body, no matter what poison it is, birth control pill, paracetamol, last night's dinner that contains some chemical junk, stuff you've been breathing in the air, all sorts of junk that your body makes, processes of normal metabolism. All this crap is in the blood, which gets cleaned by the liver. So these toxins come into the liver. They get basically made even more toxic through this enzymatic process, and then shunted into another pathway where they get rendered into substances that can get peed out or pooed out, basically, okay? So out through the urine or out through the stool. Now you can understand why it's not a good idea to be constipated. Not a good idea at all, because toxins, you need to get rid of stuff all the time. You need to put your garbage can out at least once a week, or your place is going to get pretty smelly. You're going to get maggots everywhere and mice and rats and stuff, and your neighbours aren't going to like it. Imagine if you didn't go to the toilet for 12 months. You think your neighbours would like to live next to you? My goodness. You'd be so full of what, it'd be terrible. So you need to clean yourself out. Bowels have to work properly. Bile has to be manufactured, help with the digestive process, and assist in dumping toxins into the bowel, and they can be removed through the, through the feces. So we all agree, you need good liver, you need good gallbladder. The gallbladder stores up to a pint, I think it is, 600 mils. I think that's roughly what the liver makes per day, quite a lot. So, by the way, the reason why your stools are brown, it's because of red blood cells. It's like iron, like rust. It's actually the byproduct of the breakdown or heme of red blood cells. That's why the stool's brown. Because red blood cells, I think, only last about, 30 days in the body. They get used up and then moved out. So, it's very, very important to keep your gallbladder in very good condition. To me, it acts like a reservoir for keeping palmolive dishwashing liquid in your body. All right. So, is it good to get the gallbladder taken out? I think it's a dumb idea to get the gallbladder taken out. And it's often the first thing that a lot of doctors will recommend when you present to the clinic with acute abdominal pain. We'll schedule you into the hospital. We'll just get that gallbladder taken out, and that'll fix up all of your problems. What a load of crap. The amount of people I see who've had a gallbladder taken out, who've still got exactly the same problem, is phenomenal. Now, you might be watching this now and say, well, Eric, that's me. I had a tummy pain. I went to the doctor. And then he sent me to the surgeon or the hospital. I got my gallbladder out, and I've still got the same blooming pain. What a waste of time that was. So before you get your gallbladder ripped out, like an alternator in a car thrown out, make sure that you do a gallbladder flush first. Is it safe? Hell yes. This procedure I'm going to show you is very safe. I've personally helped over 1,000 patients through this process, easily 1,000, probably more. I know doctors that have performed many, many more thousand of these procedures with their patients. It is very safe, providing you do the right thing. Nothing is safe if you do it in a dumb way, okay? Even driving a car is not safe if you don't wear seatbelts and you drink and do stupid things like that. If you follow the procedure carefully, it's perfectly safe. So what should you do? Well, as I mentioned, do the liver flush first. The bowel flush, as I mentioned in the previous video. Liver cleanse. And then we're going to move into the gallbladder flush. And this is what I want you to do. Let's assume that you've done the liver cleanse. Okay, you've taken some herbs, you've gone on a clean diet, you've cut out all alcohol, caffeine, chocolate, all the high-fat foods, processed fats, hydrogenated fats, fizzy drinks, all the crap from your diet that you know that you shouldn't be having. Now, a good time to do the gallbladder flush, in my opinion, is spring and summertime. Why? Abundance of fresh produce. All right? Especially important for liver to have a lot of fresh, clean things into your diet for a week or two. Lots of sour foods, lots of fresh foods. Watch the previous video. I'm not going to go over that stuff again. So, I want you to get hold of some good quality apple juice and drink plenty of that for 3, 4, 5 days leading into your gallbladder flush. I prefer people to buy bags of apples, juice it, and then drink 1 to 2 glasses every day, rather than buy junk in those plastic bottles in the shop that's basically reconstituted, full of sugars and junk. So my favourite apple for the gallbladder flush are the Granny Smiths, the green apples. Granny Smiths tend to be more tart, they're higher in malic acid, and this tends to be a lot more conducive towards cleaning out the gallbladder, in my opinion, than using red sweet apples full of sugar and sucrose and stuff like that. So try to go more for the green apples. Golden Delicious are good, or Granny Smiths. If you can't, any apple will do, but I prefer the green apple. Juice your own apples. Trust me, folks, it's definitely the way to go. Okay, so you've got apple juice, you've been drinking that for 2 or 3 days. Your diet, you need to cut out, in my opinion, cut out all meats for 3, 4, 5 days leading into this flush. Eat light, maybe have soups, broths, bone broth, chicken soups, fermented and cultured foods, fresh foods. So you're basically stepping your diet down and having it lighter and lighter. And the reason will become obvious later why. I'll tell you why. So, now what we're going to do, we're going to get you to get some lemons, or grapefruits, but preferably lemons, okay, and some olive oil. Now, you may have seen a lot of these videos already on YouTube, but this is how I think it's done properly, okay? So the quantity of lemon juice and oil is debatable. Some people say you need a cup, some people say you need 2 cups. I mean, I saw one video and the guy said use a gallon, using like liters of the stuff. I mean, for God's sakes, we're not elephants, you know, we're humans. So you don't need a lot of this stuff, right? So I'm going to recommend a quantity of around about 300 mils, which is about half a pint, or not even that. It's probably just over a cup, all right? So a cup's about 250 mils, so about 300 mils. So get yourself some nice lemons. I've got lots of lemon trees. I love lemons, and but you can just buy them or grow them and get them from your auntie or whatever you want. Juice them, no pips, strain them, and you've got a good 300 mils of lemon juice in a jug. Now you're going to do the same with olive oil. You're going to have roughly 300 mils, but you can use less olive oil. Okay, usually around 200 mils is okay. All right, so just under a cup. Now I tend to combine and put them in a cocktail shaker or something, shake it up, or just put it in the blender and stir it right through. So you've prepared that, right? You've got that done? Did you write it down? All right, you know what to do. Now, what you're going to do is around about 6, 7 o'clock in the evening, you're going to drink that stuff. Now, I found a good tip is to put a straw in the container and drink it through a straw, because that way you don't get it all in your mouth. You don't get that fatty stuff. And I don't mind. I mean, I drink olive oil every day anyway. I usually have a sip when I'm doing the cooking. I have a sip of olive oil, and I use a lot of lemon juice in my diet, so I can drink olive oil no problem. If you're not Greek or Italian, you know, you're probably not used to a lot of oil in your diet, so you might want to build up. So drink this mixture over a period of maybe 15-20 minutes, and then you're going to retire. Now, I've got the protocol written up here, and I'll make sure that I'm going to read it out properly. Yep. So after the mixture's finished, you're going to retire. Then you're going to go to bed. I like people to get to bed early when they're doing a gallbladder flush. You're not going to go and watch Game of Thrones or stuff like this, or Lord of the Rings till 3 a.m. and then go to bed with, you know, after you've had a packet of crisps after you've done the flush. You need to do this properly, guys, all right, or it won't work for you. So go to bed around 8, 9 o'clock, no later than that. Lie on your right side for as long as you can with a pillow elevating the right hip. Now, why would you do that? And that's so you can get the mixture in the right position, so it's going to move down there around the sphincter where the gallbladder sort of attaches, okay, to the small bowel. So that mixture will pass through the stomach into the small intestine around the sphincter of odd eye, a small sphincter there, so like a little bumhole muscle, you know, that connects the tube from the gallbladder up to the small bowel. All right. Now the gallbladder is going to see this stuff and go, what the hell's this stuff? And it's going to be, you might feel a pulsing sensation. You could feel some warmth or some sensations in your gut, like brr, brr. Some people hear these sounds, you know, you get these funny tummy sounds. So that's expulsion of junk basically into that area. It's going to move out. So it's going to try to emulsify this. It's going to try and think, whoa, I've got a huge big sink full of thousands of plates. I've got to really clean out, and I've got to put as much dishwashing liquid into the sink as I can. So it's going to move bile and all the junk out of the gallbladder into the small bowel. It's going to squeeze it all out. Now, I only had a patient in yesterday, and I didn't ask her, which was stupid of me. I didn't ask her for her jar, but she pulled out a jar, and it was about a third full with gallstones. You can go to ericbakker.com and have a look at I think I wrote an article on gallbladder symptoms and gallbladder treatment, and you can actually see some photos there of patients' gallstones, which I posted up on there on ericbakker.com. So this is a very successful technique. Now, what I expect is for you to make a beeline to the bathroom early in the morning. It could be 4 or 5 o'clock. Could be early, could be later, and you're going to have a huge, big evacuation, okay? And a lot of stuff's going to come out. So let's just say now that you've done this procedure, you're lying down, you've got the pillow under the right hip, you're sitting there relaxing, you're feeling some sensations. It all's going to go well for you, I can guarantee you. This procedure has been performed many times by many people, and many doctors have assisted thousands of patients worldwide to do this. Lots of medical doctors may tell you, it's dangerous, don't do it, you'll die. You'll die, you'll get gallstones jammed, you'll die excruciating, horrible pain. It's not the way to do it. I would not recommend this procedure at all. It's extremely dangerous. I've had some doctors say this. Now, I went to a very interesting presentation in Australia a couple of years ago, and I heard a guy talking, a medical professor, who said he's performed the procedure or helped patients, over 10,000 patients perform this procedure without one glitch. Okay, over 10,000. So if any doctor tells you that it's dangerous and it shouldn't be done, you need to get up off the chair and turn around and walk away, okay, because it's crap. If you do it properly and carefully, it's not a problem, all right? There are some rare cases where you may not want to do it. If you've got extreme medical conditions, if you're, for example, very frail, if you're like 103 years old, you're going in for a hip replacement or something, well, it's probably not a good idea. If you're pregnant, you've got twins, you're pregnant with twins or something, well, probably not a good idea if you're pregnant to do it. You know what I mean? If you've got diabetes, type 1 diabetes, and you're relying on very high amounts of insulin, well, it's probably not a good idea. So there's certain conditions where you wouldn't do it. But I mean, hello, it's common sense again. You know, common sense. Average people in reasonably good health can easily do this procedure. All right? So don't be afraid. The fear factor is huge in medicine. It's absolutely huge. You don't need to be afraid. Many, many people do it. So once you've done this procedure, you'll find you'll get up in the morning, you'll have a huge evacuation. Now, some people wish to use a colander or a strainer and actually strain the stool, and they're actually stunned to see what comes out. The first time you do it, you may get handfuls of stuff coming out. I've seen people pass out sometimes over 1,000 stones in the first evacuation. Incredible, but true, right? But it's up to you how you do it. So, you know, the procedure I'm talking about, it's up to you how much lemon juice you take, how much olive oil you take, how far you want to take this thing. All right, so you don't need large amounts of stuff. If you're a little bit scared or a little bit anxious about things like that, you may want to start maybe with a tablespoon of lemon juice and a tablespoon of olive oil. But trust me, it does work highly effectively, and the quantities I've shown you are perfectly normal for average people of average build. All right. So you've expelled gallstones. What are you going to do next? Well, what you're going to do is you're going to stay on a reasonably clean diet for about a week leading out, and then going back to your normal diet. And then you're going to wait about a month, and you're going to repeat the procedure, right? And you're going to repeat the procedure, and if you pass out gallstones again, I'm going to recommend you repeat it again, and again, and again, and again, until you pass out no more gallstones. Now, believe it or not, some of my patients have done this procedure 10 or 12 times, and each time they passed out stones. Others have done it 3 or 4 times, and they only had a dump on the first or second occasion, and on the third they didn't pass out any more stones. It's up to you to find out what comes out, and then to, you know, reevaluate your health and think, should I repeat the procedure or not? So that's your call, right? It's highly effective. One patient annoyed the hell out of me years ago, this quite large lady who came to me, who was scheduled, in fact, for a week from the date she saw me to have a cholecystectomy or her gallbladder taken out. And I said, don't do it. Don't do it. Be careful. Rethink what you're doing, you know. And she said, well, I wasn't going to anyway. I came to you because I don't want knives put in my body with surgeons and stuff, so I want to see how we go. Anyway, I went through the procedure with her. She went home. She did it. I got a call back after about 14 days, and she was delighted. She was delighted that she can go back into eating lots of fatty fish and chips again, at least 2 times a week without nausea. Well, that's not the whole idea. The whole idea is, when you've cleaned out the gallbladder, is to stay on a reasonably healthy diet, okay? I don't mind if you have fish and chips or fatty stuff here or there, but please don't do it 3 times a week or eat chocolate daily, because you're going to gum that gallbladder up again, all right? The gallbladder is vital to health. It's very, very important that you keep the gallbladder in good condition. It's a very important part of the liver function. It does form a vital role. Just like the tonsils, it's not a good idea just to chop it out and throw it away because it's some useless body part that we could all do without, okay? So that's the liver, that's the gallbladder flush. Give it a go and give me some comments when you've done this, and I'm quite happy to see some photos of gallstones from different people as well, which might be actually good to actually show on YouTube, different people, to give other people confidence to do this procedure. Don't forget to click on my link below for a free report. And also, don't forget to subscribe. Thanks so much for tuning in.